It's important because bacteria and other pathogens can survive on surfaces for long periods of time. This means that when a patient touches these surfaces that are contaminated with these pathogen bacteria, they get them and later they can be infected with them and have a problem with this infection. In fact, it has been shown that in places where a patient that has had an hospital-acquired infection, if you put another patient in that room later, it has a chance of 25%, around 27% to get this infection also, this patient. The problem is even worse because sometimes these pathogens are antimicrobial resistant. This means that you cannot treat them with most of the antibiotics that we have for treating infections. This is more complicated and also it has a higher mortality. So we have to prevent this kind of infections, and that's why iSafeTouch is so important, because we can have surfaces that are not contaminated with bacteria. It will be good for patients because the risk of transmission of these infections is going to be very low, and the stay at the hospital will be safer. Disinfection and cleaning surfaces is a way of controlling, of preventing and controlling the infection that you have in the hospital. The thing is that normally in the hospitals we used to disinfect the surfaces and these things, but as soon as someone touches these surfaces again, it's contaminated, it's newly contaminated. So we need systems that can provide a continuous way of disinfecting these surfaces. In this way, iSafeTouch is very important because every time that someone touches the surface will be decontaminated. So that's why we need systems like that in the hospitals to prevent recontamination of surfaces. Also, take in mind that cleaning surfaces continuously is very hard and it's expensive. So reducing the need of doing this process of disinfecting continuously will reduce the burden of working in the hospitals. That will be, I think, is a good thing for workers in the hospital. Well, it's important because patients through surfaces can transmit these pathogenic bacteria to staff members of the hospital and also to visitors. That later they will be out of the hospital or can spread these pathogenic bacteria in the community. So that's why it's important to have surfaces clean in the hospitals. Besides, this project is important because it can be applied not only in the hospital but also in the community. I mean, for instance, in public transport systems or things like, or in settings similar to that. Just, for instance, in the seasons of flu or for avoiding transmission of coronavirus in the community, it can be also an important role of this device.